Caryn, you know, it's amazing to me how many patients I'm seeing these days on blood pressure pills, many at a really young age.
Oh, I know. I just got off the phone with my girlfriend, Trixie. Her cousin, 32 years old, was just put on high blood pressure medications.
Wow. You know, it's even more amazing, though, how many patients I'm able to get off their blood pressure medicines just through a healthy lifestyle.
Oh, I'll bet, because I'm on staff at a health immersion, and every single time we have a session, about 2 to 3 days in, somebody falls, just passes out because
blood pressure's too low.
That's right.
Yeah. Right.
So why is controlling our blood pressure so important?
Well, blood pressure is a major risk factor for heart disease, heart attacks, risk factor for strokes, increases risk for heart failure. And it's also one of the leading causes of kidney failure. More people go on dialysis because of poorly controlled blood pressure than any other reason. 99% of people have what we call primary or essential hypertension. What that means is it's high blood pressure for no good reason. There are a few people that have what we call secondary hypertension, and that's high blood pressure because of something else. You know, things like chronic kidney problems or adrenal gland problems or thyroid problems. It is important to find those people, because if you find the underlying problem and treat it, the blood pressure goes away. But again, the vast majority of people have this primary hypertension, heavily influenced by lifestyle. And we know that losing weight, increasing your fiber and decreasing your fat intake, more physical activity, limiting your alcohol intake, watching your sodium intake, and eating more potassium are the best ways to lower blood pressure.
Okay.
Oh. Okay. Is this about K / potassium, like the periodic table?
Maybe.
Oh, that was pretty good, I have to say.
Okay.
Well, so potassium.
Yeah.
Why potassium? Why is that important? Well,
Yeah.
a couple reasons. So potassium actually helps relax blood vessels, and when our blood vessels are able to relax more, that can lower blood pressure. They also help kind of compete with sodium in the kidneys, so it lessens the effect of sodium. And so it's very important, again, to have plenty of potassium in your diet.
Well, then how much do we need?
Well, you know, it's interesting because many people, when we think about blood pressure, it's about salt, sodium. Salt being the major source of sodium in the diet.
Yeah.
And you need about 1,500 milligrams of sodium a day to limit it to that. But more important than that is attaining a ratio of about 3-to-1 potassium to sodium. So for every 1,500 milligrams of sodium, that equals about 4,500 milligrams potassium. So it's maintaining that 3-to-1 ratio potassium to sodium.
Okay, so there's math involved. But what foods are going to have really the most potassium?
Well, most people, when I mention potassium, the first thing that comes to mind are bananas, right?
Right.
So each of these bananas has about 400, a little more than 400 milligrams of potassium.
That's it?
Right. So these 10 bananas is what you would need to eat each day to meet your potassium needs, right?
Well, that's just bananas.
It is. Okay. Stop it. Stop with these food puns. But there's lots of other foods that are very high in potassium. For example, this cup of spinach here, that's about 2.5 bananas worth of potassium.
Okay.
This potato here, another 2.5 bananas. The beet greens here, a cup of beet greens, 1,300 milligrams. So these are each about 1,000, 1,300 milligrams. So this is the equivalent of 4.5 bananas just right here.
I mean, that's crazy. This would be just like one serving of beet greens?
Right, so you got 1 cup of beet greens.
Oh my gosh. Okay, well then, if we know what foods have the greatest amount, can we get too much?
Well, it's only a concern if you have chronic kidney disease, if you have kidney failure, if your kidneys don't work, because when our kidneys don't work well, we can't excrete the potassium efficiently, and the potassium can build up in our bloodstream, and that can predispose you to heart arrhythmias and things like that. So if you've got chronic kidney disease, you certainly want to talk to your doctor before you start really trying to increase the amount of potassium in your diet.
Yeah, really good to know.
Yeah. So, Caryn, I have a question for you. Can you show us a simple recipe that's loaded with potassium that are really going to help people improve their health and get off some of that blood pressure some of those blood pressure pills?
You know I do, but it is not going to include any bananas. Is that okay?
That's all right. That's bananas.
All right. Okay. Let's get cooking. This is one of my all-time favorite go-to soups. It's creamy beans and green soup. Ready?
Can't wait to try it.
All right, so we're gonna turn on our burner up to high.
Right.
And we're gonna start with some onions. And carrots. Those are sliced pretty thinly so that they cook really quickly.
Right.
So we're just gonna,
Now I notice there's no oil in that pan.
there is no oil in that pan.
Don't you need oil to saute onions?
Well, you can use oil if you want to, but at 126 calories per tablespoon, I am not going to add it in there.
Yeah, good for you.
You just really, this is really called a dry saute
Yeah, sure.
because we're not using any oil or
Right.
an abundance of water or broth, which is what I used to use.
And look at that, the food's not sticking.
It's not sticking. This is really an exercise in mindful cooking. You want to stay on top of your food.
Right.
So keep everything moving, and you'll notice that the ingredients that we're using all have a lot of water in them.
Right.
Right?
Right.
So that water, once it's heated, starts to
Come out.
out.
I got it.
And then we can start to, everything just moves around the surface of the pan really well, really easily. Now you just want to make sure that when you're doing this, have a little bit of either water or vegetable broth off to the side.
Right.
Because you may get some browning and you just want to pull that up off the floor of the pan
Right.
and back into the food. That's
Right,
called
right.
a deglaze.
Right,
So-
sure. All right.
So I'm going to pull my heat down just a little bit. I like to get a cooking temperature, which is medium high. Okay, so we're getting nice. You can almost start seeing some of that.
Browning, yeah.
Yeah, on
yeah.
those onions.
Smells
So-
good too.
Oh, I love this so much. Okay, so let's go ahead and add our shallot. Now a shallot is really pretty delicate, so we're not going to give that too much time to cook there because we want to add in the rest of our ingredients. Oh gosh, that scent, ooh, so good, so good. Now, if you want to add in our Yukon potatoes, which I have peeled and cut to a bite size, and then add in our artichokes. That's one can, a 14-ounce can of the artichoke hearts that I've quartered.
All right. So this is what we already talked about. It's like 1,000 milligrams of potassium. I
This
think the
is-
artichokes have about 500 milligrams of potassium.
So full, so
Right.
full. So I'm gonna get our,
A little bit of your homemade brezzi broth there.
that's right, baby. Okay, now these are white beans. You can use cannellini beans, or you can use just these white navy beans, really whatever you come across.
And they even have potassium in it.
They do,
Right?
yeah.
I think
Well, you
we
just look at-
calculated, yeah, that's like 800 or 900 milligrams
Oh, my
of
gosh.
potassium in a couple cans.
So much, so much. All right, so now what we're gonna do is, because we want to toast our spices, and so they become even more aromatic.
That's just some Italian seasoning and a little crushed red pepper, right?
Yeah, and you certainly don't have to add the crushed red pepper if you're really sensitive to heat.
Right.
But we're gonna give this just a minute or so on. Oh, yeah. Can you smell that? Just
can,
how those,
yeah, my
those
goodness, yeah.
spices just really open up when you
Right.
heat them. Oh gosh, yum, yum, yum. Okay, so now, because we have our beans in there, we
Right.
want to add our greens in there. So what I'm going to do is now add some of our broth. We're going to add about 4 cups total.
Yep.
Let me get that going because I know the bottom of the pan was getting a little bit brown.
Yep.
So now I'm just pulling all that up.
All that flavor, right?
All that flavor, yeah. So I'm gonna pull our temperature up as well. Okay, now we're nice and coated in. Oh my gosh, smells so good. So we're gonna add in just a little bit more broth. This serves 4.
Okay.
You can see how much is in there. Oh my gosh, it's gonna be so filling. There we go. Okay. Now I'm gonna add in, I've chosen to use bok choy today
Right.
because it is, yes, it's high in potassium, but I like to think of it as like a gateway green
Right.
because there's really not a whole lot of flavor to it.
Right.
And and it also cooks down very well. So what an opportunity to add greens
Right.
to a meal, right? You can just
Right,
put it
right.
right into your soup.
No, you're right. I have friends and family members who are kind of green averse. You would think that they're going to get cooties or something if they eat some green food. But you're right. I mean, hiding it in a soup or a stew is a great way to add greens and add all that it's packed with nutrients, right? Again,
Yeah.
potassium and the fiber and calcium and all those other vitamins and nutrients we need. That's a great way to do that. So.
It's not just always about eating a salad, right?
Right,
You can
that's
add
right.
it to anything.
Right.
All right, so we are going to allow this to cook for about 20 minutes.
I'm going to cover it up.
Please do.
All right.
We'll come back and we'll have lunch.
All right. Sounds good.
Just a few more steps left. Oh, wow.
That smells so good.
So good. Okay, I'm going to turn off the heat. Now this is called my creamy beans and greens for a
Right.
reason, because
Yeah.
I'm going to take this immersion blender
Yeah.
or stick blender.
Yep. One of the
And-
greatest inventions ever, by the way.
You know it's one of my favorites,
Yeah.
because we don't have to get out the big blender. Now, if you don't have a stick blender or an immersion blender, you certainly can just take a couple of batches of soup and put it into your blender.
Right.
No big deal. But this really just does the job right for you in this pan. Oh, look at that.
Yeah.
And this, another reason that I really enjoy doing this and having these creamy soups, after you blend all the ingredients, it really just
Flavors.
comes together.
Yeah, the flavors, yeah. And,
So-
but also, I like it because you can leave a little bit of texture in the food, right?
That's right.
So I don't like blending it completely smooth,
That's right, yeah,
but
just as we
mostly
did.
smooth. Yeah, exactly. So there's still a little chunkiness with it, if you will.
That's right. Yeah, thanks. Okay, so we are going to hit this
sorry.
with, here we go, with one more
Give me that,
batch
napkin over
of,
there.
yeah, one
Thank
more
you.
batch of greens,
Thank you.
more potassium.
Yep.
Okay.
Okay. I see what you did there.
That's
Again,
been-
these food puns
I
are
know,
gonna
I know,
have
I
to
know.
stop.
I know, it's a little cheesy.
Yeah.
All right, so.
Well, not cheese. It's not
Okay.
really cheesy.
No, it's not cheesy. Oh my God, stop. This, now look at that spinach.
that
It's
looks
just, it just
amazing.
wilts down immediately
Yeah, it's
because there's
amazing.
so much water in there.
Yep.
Okay, now for the last and final step, we're gonna brighten it up just a little bit by adding a squeeze of lemon.
And by the way, just another kind of nutrition fact. Things like
Iron.
spinach, yeah. So spinach has a lot of iron in it, right? But it's a different kind of iron that you find, say, in red meat. And to optimally absorb the iron that's in spinach, you need to have a source of vitamin C. So when you finish a soup with a little lemon juice, for example, which is high in vitamin C, that really makes that iron accessible. So it really bumps up the nutrition even further.
Good to know.
Oh my goodness, this looks
Good
good.
to know. Okay, so,
In my belly.
oh, you probably need a spoon.
That would be helpful.
Okay, there you
Although
go.
I don't know, I could probably. You have a straw?
Well, maybe. All right,
All
it's gonna be
right.
hot.
Yeah. Cheers.
Cheers. Okay.